Pasi, Dr. Nettles, good to see you again, my young friend.
Good to see you, good to see you.
You get better looking and bigger every time I see you.
Is that so?
That's right.
Okay, let's enhance my look.
That's right. We talked earlier about what we're going to do. You were a hockey player, had a frontal impact to the nose, flattened the tip of the nose, and it slightly tilted you to the side. And we talked about how we're going to correct that using a dermal implant. We're going to build the tip of the nose and straighten the tip, and then build up the bridge of the nose and give you more definition so you have a little bit better symmetry. We're going to take a good nose and make it great.
Sounds like a plan.
Let's get started.
Okay. Is there any downtime with this procedure?
There's going to be very little downtime. We're going to start with a little local anesthesia and numb up the area so you don't feel anything. There's going to be almost no downtime after the procedure. You're not going to feel any pain. Should feel minimal discomfort. We'll start with a little lidocaine, okay? Turn towards me. Good. You can close your eyes if you don't want to see a needle coming at you. Good. Okay, we're going to start with building the tip of the nose, okay? I'm going to lean you back just a little bit. So traditional plastic surgery would be, cutting underneath the nose, shaving down parts of the bridge of the nose, and taking an implant sometimes from the back of the ear. And the last 5 or 6 years, through different technologies, dermal implants have really revolutionized what we can do without surgery. So now I can introduce a similar implant through the tip of a needle, and then I can mold it into place. And this should last for about 2 years. So every 2 years you come back in for a 10-minute procedure. Okay. I feel a lot of scar tissue underneath the nose from the previous fracture that you had. So we're just building above the nose. Dermasurgery is a field that works just above the nose, just below the skin, so it allows me to mold the implant right into place. Almost finished. You're doing a really good job. You got a little edema. The swelling is going to go down in the next couple of days, and it's going to leave a perfectly straight nose. For the next 7 days, I want you to avoid wearing sunglasses or touching it, and be careful how you sleep. Allow the implant to sort of stay in its space where I've injected it, okay?
Okay. Wow.
Let's talk about what we did, okay? So what we did was we augmented the right side of the nasal tip to sort of make it match up with the left side without widening it too much. Then we lifted the bridge from the tip all the way to the top point of the nose. This is sort of, instead of being flat, now it's rounded. It looks very normal. And it separates the sides of the face from the right side to the left side, creating amazing symmetry, and it's very, very nice. You did a good job. There's a little bit of swelling, a little bit of blue spots. This will go away in about 2 days. You did a great job.
Perfect. Thank you. Wow, what a difference.
You can put your fingers in and you can feel a little bit. Every time I move here, this is the implant underneath the skin.
Yeah, because I felt like the hard part, the broken nose area here, was even.
Yeah.
Wow.
Great job.
Thank you. Thank you.
You're welcome.